Welcome to ISOT 2023. This is the 33rd episode of Indian Society of Organ Transplantation meeting that we are having. And this time it is being held in Kolkata from 5th to 8th of October. And you are one of the eminent speakers there. So as everyone knows, your passion for IgA nephropathy, and by virtue of my stay at Leicester, I also know how much passionate you are about your work. But just to start off with a small introduction, Professor Barratt's research is focused on pathogenesis of IgA nephropathy and a range of areas across renal medicine, including glomerular disease, multisystem renal disease, and complications of chronic kidney disease, in particular renal associated anemia. He is the IgA nephropathy rare disease group lead for UK National Registry of Rare Kidney Diseases and leads the renal research group within the College of Life Sciences, University of Leicester. He also participates in other IgA nephrology initiatives such as International IgA Nephropathy Network and in the work groups, identifying endpoints for clinical trials such as FDA and the ASN Clinical Health Initiative. Professor Barratt has been principal investigator for international randomized controlled clinical trials in IgA nephropathy and has attended both the FDA and EMA as an expert witness for the new therapies in IgA nephropathy. He is an editorial board member for Kidney International and Clinical Journal of American Society of Nephrology and sits on the Kidney Research UK Grants Committee. So this is in short an introduction to Dr. Barratt. And now we'll come to the legend himself. Sir, welcome to the program. And, if you can, enlighten us about your work and currently that you're doing and, whatever areas of interest that you're pursuing.
Thanks very much, Piyali. I am really looking forward to coming to Kolkata. I'm currently in Tokyo, having been present at the International IgA Nephropathy meeting. And we had Suksina Alexander come and give some great talks about IgA nephropathy experience in India, which was fantastic. And I'm looking forward to coming and meeting friends and colleagues in Kolkata to talk about glomerular disease in the context of transplantation and the kind of challenges that we face managing transplant patients who have recurrent glomerular disease. My passion is to bring new treatments to patients with glomerular disease. So you may not want to hear this, but hopefully so that none of them ever need a kidney transplant in the future. But we have to accept some will. And I want to make sure that the treatments that we're developing for patients with IgA nephropathy and other glomerular diseases can be used in those patients who get a kidney transplant and unfortunately suffer recurrent disease. So we've got lots of exciting new therapies, and we are going to need to make sure our colleagues are educated in how to use these. So it's going to be great to meet up with, as I say, friends and colleagues in Kolkata, where we can talk about glomerular disease in the context of kidney transplantation.
So, so you've been dealing with a lot of IgA nephropathy all over the world. And I just wanted to know whether, you could enlighten us about a few precautionary measures that we can take here in India itself. As you know that we have a younger population. So while in the UK, I had, experienced that the patients undergoing dialysis there were mostly the elderly population. But unfortunately, in India, we have a much younger population, and they come, they present at a later stage of the disease when we don't even come to know about the origin, about the basic disease. So do you have any suggestions by which we can, assess the patients so we can catch them earlier, and any programs that runs in the UK that we can emulate, or anything that we can do, to catch them earlier?
Yeah, I mean, I think the key is to identify patients early. And we need to accept for IgA nephropathy that it is an asymptomatic disease. And while I'm not sure you're going to get a countrywide in primary care physicians, in hospital doctors, how important it is to look at the urine analysis. And if you see blood and you see protein in the urine, don't assume it's a urinary tract infection, which of course is the commonest reason you might see it. But always have in your differential diagnosis, does this person have a significant glomerular disease? Because if we can diagnose it early when it's asymptomatic, we have the opportunity to intervene and we will delay progression of kidney disease. So I think the one simplest and easiest thing is we need to work with our colleagues outside of nephrology to understand how important it is to act on an abnormal urine analysis, act on a raised blood pressure, act on an abnormal blood test to think, could this be kidney disease? Could this be driven by glomerular disease? And then to move things forward. That's what we need to do in the UK. It's not specific to India. It is everywhere. I teach general medical trainees, and I guarantee you, they don't look at the urine analysis. I guarantee you every patient admitted in the NHS has their urine dipped. Mm-hmm. And it's probably the cheapest investigation, but people don't look at it. And if they look at it, they don't understand and act on it. Mm-hmm. And, you will have seen when you were in Leicester, Piyali, how many times do we take people from other wards who've got edema and be treated for heart failure, and then someone decides to dip the urine and see they've got lots of proteinuria. Mm-hmm. So it happens everywhere. Raising awareness of the importance of urine analysis is really key, I think.
Mm-hmm. So as you mentioned earlier, it's very exciting time for IgA nephropathy because multiple treatments are coming up. And, there's a huge prospect of treating IgA nephropathy, tell us about your experience of using some of those, the treatments that have come up.
Yes, so we've been involved in all the clinical trials. So we've treated people with enteric budesonide, so Nefecon. We've treated people with the new endothelin receptor antagonist, sparsentan, and with atrasentan. We've treated people with the B-cell modulators, so the anti-APRILs, and we've treated people with complement inhibitors. And my overwhelming view is that each of these classes of drugs are going to allow us to manage IgA nephropathy better. But we are going to need to understand how we use these drugs together, and we're going to need to understand how we monitor our patients who are having multiple new therapies that we quite frankly haven't used before. So I think there's going to be lots of need to educate our colleagues about these new therapies. And I'm very excited because I see lots of potential opportunity with these therapies to manage our patients better.
Okay, sir. So thank you so much for giving us your precious time. I know it's very late in Tokyo at the moment. However, so welcome once again to the city of joy, that is Kolkata. And I am a Bengali and I belong to this place. And I'm looking forward to show you around Kolkata. So this is the best time of the year to visit India in general and West Bengal also in particular, because this is the time when we have the largest annual festival that we have, Durga Puja in Kolkata. So with that, I end my interview today, and welcome to ISOT 2023.
I look forward to seeing you in the next couple of days, Piyali. Bye-bye.
Bye, sir. Thank you.